So Cameron, can I ask you a few quick questions about your teeth in your mouth?
Yeah, sure.
Great. The health of our mouth really is important for our overall health. So what do you know about cavities?
Well, I know that there are holes that are in my teeth that do bad things, I guess.
Yes, cavities are holes in our teeth. They are the result of bacteria that live in our mouth that digest sugars that create an acid and then erode the enamel or the covering of our teeth. But the good news is that they're largely preventable.
Wow, I didn't know that.
Yeah. So can I ask you a few questions about how you take care of your teeth?
Yeah, definitely.
Can you tell me how you brush them?
Well, I usually brush in the mornings before I go to school. I just have an electric toothbrush, so I just go back and forth across my teeth for about 1 to 2 minutes.
I love that you're using an electric toothbrush and that you're brushing up to 1 or 2 minutes. That's what we want you to do. What about in the evenings?
Well, I don't usually brush my teeth in the evenings.
Yeah, a lot of people forget, or they just fall asleep, or they just don't get to it. But brushing your teeth before bed is really important. You've got to get all of those sugars off your teeth so the cavity germs can't digest it and make those acids. What do you think you might be able to do to help yourself remember to brush your teeth at night?
Well, since I play sports, I usually take showers in the evenings after I get done with all my events. So maybe I'll try to include brushing my teeth into before or after shower routine.
What about flossing?
I don't really floss. I know I should, but I usually forget.
Yeah, it's common for people to not floss. It's a habit that's hard to adopt. Do you have floss at home?
Yeah, I do.
Okay, great. What would be realistic for you? How often do you think you can start to floss your teeth?
I think 3 or 4 times a week would be a good place to start.
Wow, I love that. That's a really good goal. That'll help clean the areas between your teeth where your toothbrush just can't get. Do you know if the toothpaste you have contains fluoride?
I don't really know. It's the regular kind, I think.
Okay, we do want you to use toothpaste with fluoride. So if you look at the toothpaste you have at home, you can see that the active ingredient in there is fluoride. So when you get home, would you look at your
Yeah,
toothpaste?
I can do that.
Yeah. The other important part about cavities is what we eat, especially sugars, the sugars that we drink and the sugars that are in our snacks. So can you tell me a little bit about the snacks and drinks that you have?
Yeah, I drink soda most days, and I eat a lot of chips and sugary snacks.
Yeah, they're delicious, but they are really hard on our teeth and our overall body. Can you think of any other snacks that you might be interested in that have a little less sugar in them?
I don't really know. Do you think you could have some options for me?
Yeah, so for sure. Some ideas that I think about are cheese, carrots, apple slices, any fruit slice. They're sugary, but they don't have as much sugar as processed foods do. So those would be some things that I would suggest. Are those foods that you have at home?
Yeah, I have those.
Yeah. And could you tell your mom about that?
Yeah, most definitely.
Okay. And what about the dentist? Have you been to the dentist? And do you remember what happened at the last dental visit? Did you have any cavities?
I think it's been at least a year, and I think I had 3 cavities filled last year.
Okay. So Cameron, from what you've told me, brushing only once a day, not flossing, having sugary drinks, and that you had cavities the last time you saw the dentist, your chances of continuing to get cavities is quite high. So I'm hoping that we can bring your chances of getting cavities down. Would that be something that you'd be interested in talking about?
Yeah, I definitely want to do that.
Okay. What are some things that you feel you might be able to do when you get home?
Well, I can talk to my mom about getting a dental appointment set up, and I can start brushing my teeth before I go to bed.
Okay, those are really good goals. On a scale from 1 to 10, where 1 is like there's no way I'm going to be able to reach those goals, and 10 is like for sure I'm going to be able to do that, where would your confidence level be on telling your mom about the dentist?
I think in 10.
Okay, and what about the brushing your teeth in the evening?
I think around an 8.
Okay, those are both really good scores. So that tells me that those are realistic goals for you and that you're likely to be able to be successful at reaching those goals.
Okay.
Okay, reach out to me if you have any questions about the conversation we had today. Happy to talk to you more about it.
Okay, that sounds good.
Okay, have a great day.
You as well.
Yeah, take care.
Thank you, Dr. Simmons.
Mm-hmm.